Good evening, friends. So, today we are discussing the heel pain. In the last class, we have discussed the three causes of the heel pain. So, today we will continue our discussion on the heel pain. And today we will also see the points. So, let's start. So, we are discussing heel pain. 1 minute. We'll send the link to few people asking me again. So let's elaborate the how many causes are responsible for the heel pain. So number one cause, the number one cause is bone enlargement of the heel. The bone enlargement in the heel are responsible for the heel pain. We know in our heel we are having total 7 bone in our ankle joint. In the ankle joint, we are having 7 bones here. The lowermost bone is called calcaneum. We can see in this image because we have already discussed in the last class. So we will just do the quick summary. So this is the heel and this is the bigger bone out of 7 bone. The name of this bone is calcaneum. The name of this bone is calcaneum bone. And because of overweight, because of tear and wear, because of some accident, injury, many times there is a enlargement of the bone. So this is the enlargement of the bone in some part. So this is called calcaneal spur. The spur in the bone of calcaneum. So calcanear spur found in the calcaneum bone. And so the many times person having very tight fascia. So we can see this is the fascia, very tight fascia. Maybe because of the tight calf muscles, because we know calf muscles is on the back side of leg. So the person having very tight fascia or maybe because of the improper shoes, or the person walking a lot or overweight. So there may be any cause, but because of any cause, if this fascia is very tight, so this is also causing the heel pain, and this is called plantar fasciitis. Plantar fasciitis, the inflammation of the plantar fascia. If someone is suffering with the plantar fasciitis, so the person will be having pain in this lower part. Too much pain here. Too much pain here. Then doctors are advising, orthopedics are advising to apply the ice. To apply the ice. So we can do, so we can apply the ice in this part, because this is the inflammation of the fascia. So we are applying the ice here. Or we can fill the water in the bottle, keep in the refrigerator, and rolling the bottle here in the fascia. So we can see some bottle like this, or little thin bottle, or even plastic. We will take the plastic bottle. We will fill this bottle with the water, and we are keeping the bottle on the floor and keeping our feet here and just doing the rolling over the ice bottle. Look at my feet. So look at my feet. This is my feet. So I have to keep the bottle on the floor. Then I keep on rolling the bottle over the bottle filled with the ice. So this is very good for this plantar fasciitis. If someone is having pain here in the fascia or this part of the fascia, because fascia is starting from here, then fascia is going here, here. Fascia is going towards all the fingers. And when this fascia is tight, the pain is coming over the heel, and especially in this part. In this part, if you press the heel, this will be painful. So the one cause, this is the bone. The name of this bone is calcaneum. So if there is a bone growth or calcaneal spur, that is the cause number one. And second is plantar fasciitis. So the pain will be in this part in both the condition. If there is a spur in the bone, then pain will be here. And the plantar fasciitis pain will be here. In both the condition, we have to apply the ice here. We have to remove the inflammation. So now, the next cause is, look at this. This is the tendon on the back side. The name of this tendon is Achilles tendon. So this is the bone, calcaneum bone, and this is the tendon. So in between tendon and bone, we are having one fluid filled pouch. The one pouch is here in between. So on the back side, this is the tendon. On the front side, this is the bone. In between, we are having one single pouch. Let's see in the other image. So look at the image. This is the tendon. The name of this tendon is Achilles tendon. And this is the bone. The name of this bone is calcaneum bone. And this is Achilles tendon. In between this tendon and bone, we are having one single pouch here. The name of this pouch is bursa, or we can tell, because this is on the back side of calcaneum. So we will tell calcaneal bursa. The bursa who is on the back side of calcaneum. So many times what is happening? Because of climbing on the stairs, climbing on the hill, doing the trekking or getting down from the height, this bursa is getting inflamed. So this is called bursitis. So we are also applying the ice here, bursitis. So the bursitis means inflammation of this bursa, which is the sac filled with the fluid, so that during the movement there will not be any friction between this tendon and the bone. Now, the last cause, not last, we can tell the second last, if this tendon is very tight, if this tendon is tight, this tendon is very tight, then also it can create the heel pain. We have already discussed yesterday. So this is called Achilles tendinitis. The inflammation of the Achilles tendon. So this tendon will be very tight. If you do the little bit stretching, then there will be pain in this part. So look at here. If the person is having Achilles tendinitis, so which stretching giving the pain? So you can find out, yes, that this is the case of Achilles tendinitis. The person having the problem in the Achilles tendon, and you do this movement, so this will create the pain. But if you do this movement, this will relax the pain. Why this movement is giving the pain? Why this stretching the leg giving the pain? Because if you stretch this will be tighter, more tight. But if you do little bit like that, then this will be loose, then no pain. So if someone is suffering with the Achilles tendinitis, during that time, if the person wearing high heel, the wearing the high heel will give the relaxation here. Because when you wear the high heel, this will be little lift up in the upside and this will become loose. So no pain here. But if you do it tight, then this will be tight and the pain will be created. So this is the Achilles tendinitis. So let's write down all the causes, then we'll proceed. So the cause number 1 of the heel pain is calcaneal spur, the growth of the calcaneum bone. And okay, we'll make it cause number 2. The cause number 2 is the tight fascia or called plantar fasciitis. The cause number 3 is the inflammation of bursa. So cause number 3 is called retrocalcaneal bursitis. Cause number 4 is tight tendon. So that is called Achilles tendinitis. So there are 4 causes. One cause, the growth of bone. The second cause, the tight fascia. The third cause, the bursa is swell and inflamed here. And the fourth cause, the tight tendon. Tight tendon. So let's write down in the simple language once again. The cause of heel pain, number 1, bone growth. The cause number 2 is tight fascia. The cause number 3 is bursa is inflamed. The cause number 4 is tight tendon. So these are the main 4 causes. So let's write down all the 4 causes, then we'll see the 5th number cause also for the heel pain. So the cause for the heel pain, number 1 cause, the growth of the bone, the growth of calcaneum bone or called calcaneal spur. The cause number 2 is inflammation. The cause number 2 is tight fascia. Or plantar fasciitis. The cause number 3, inflamed bursa. Or retrocalcaneal bursitis. Cause number 4 is tight tendon. So Achilles tendinitis. So there are the 4 causes for the heel pain. Now the cause number 5 is high uric acid or gout. So when someone is suffering with the uric acid or gout, the pain will be bilateral. Pain will be on the both side of feet, both side of heel like this. Look at this heel. The pain will be here and the pain will be here. This side and this side on the both side of the heel. In the uric acid. So with the site of pain, you can find out what is the problem. So you are pressing here and this is paining. This is the spur. If you are pressing in the medial side of where curve starts, so this is paining. This is plantar fasciitis. If you are pressing here, here is paining. So this is bursitis. Even in the bursitis, pain may be little downward. And if while doing the stretching, if this is paining while stretching, then this is Achilles tendinitis. So this part is painful, Achilles tendinitis. Okay, in all the condition, you have to apply the ice application. So what is the treatment protocol for all the problems? For uric acid, we have to work for the uric acid. But for other, what is the protocol for heel pain? Number 1, the DU20. Why DU20? Because DU20 is located in the upper part of the body, in the top of the body. That is the DU20. So the top is treating the bottom and bottom is treating the top. This is the relationship of the two ends. If you do something in the bottom of feet, it will treat the top. If you do something on the top, it will treat the bottom of feet. So when we stimulate the DU20 point or governing vessel 20 point, the governing vessel 20 is the topmost point of the head and it is treating the bottom problem or the heel pain. So from the governing vessel 20 on the top of the head, we can go 1.5 chun all around and can treat this area 1.5 chun. all around and treat this area. And D20 is the tranquilizer point. So it is calming down the brain and releasing the pain. And EBBC in the sujog, we'll see the location in the sujog shortly. So the next point will be LI4 because LI4 is the painkiller point. So we'll sedate the D20, we'll sedate the LI4, it is the painkiller point and useful for all types of pain, in the all types of pain. Now, in the heel pain, either the problem is connected with the bones or the problem connected with the fascia or the tendons or the bursa. So we will take urinary bladder 11, which is the influential point for bone, and we will take the gallbladder 34, which is the most important and the influential point of fascia, muscle, tendon, and bursa. So our protocol will be DU20, LI4, UB11, and gallbladder 34, sedate all. So this is the common protocol. Now, we will go to the local area in the feet. So we are going in the local area of the feet. In the local area of the feet, we will stimulate the point all around the heel. So look at the heel area. So kidney 3 point, kidney 4, kidney 5, and kidney 6. These 4 are the local point around the heel. Kidney 3, 4, 5, 6. And we will go to the other side and we'll take urinary bladder 60, 61, and 62. And we'll come to the anterior side, we'll take 3 points of the gallbladder, that is the gallbladder 39, 40, and 41. That's it. So with the help of these points, we can work successfully for all types of heel pain. So the local point will be kidney 3, 4, 5, 6, urinary bladder 60, 61, 62, and gallbladder 39, 40, 41. So these all are the local points. So this is the protocol. There are always possibility of little bit changes. So let's see how can we stimulate the points in the sujok. So look at the image. So look at this image. We are looking the palm from the dorsal side. In the middle finger, we are having three meridians. In the center, we are having gallbladder meridian. In the outer side, we are having urinary bladder meridian. And in the inner side, we are having stomach meridian. So right now, we have to focus on the gallbladder meridian and on the urinary bladder meridian. So let's start from the gallbladder meridian, the center one. So in the gallbladder meridian, we have to take the 3 points. The one, this is the joint. This is the joint. 1 minute. This is the upper joint. Just go 1 millimeter up. That is the location of gallbladder 41. And we can see we are going little up from the joint. That is the location of gallbladder 39. And just on the joint, just on this joint, because this joint is corresponding our ankle joint. So just on the joint, we are having this point, that is gallbladder 40. So the 3 point, we can put the visual magnet, we do the sedation, we'll sedate all the point. Or we can put the methi seeds, fenugreek seed. So now we are coming to the urinary bladder meridian. So the 1 point will be just on the joint, that is urinary bladder 60. Then just a little down, that is 61, urinary bladder 61. And the last point of the urinary bladder meridian here, the next point of the urinary bladder meridian here will be urinary bladder 62. The urinary bladder 62 point will be little on the inner side toward the gallbladder meridian. So this is the point, urinary bladder 62. So putting the methi seeds, you can see the chart and put the seeds. So when you want to put the seed, just see the chart and put the seed. So the 3 point in the gallbladder meridian and 3 point in the urinary bladder meridian. These points also working like a body point. They are very much effective. Now we are going to the yin side. अब हम yin side के point देखते हैं. Let's go to the yin side. 1 minute. So looking the front surface or palmar side. So now we are moving to the palmar side. 1 minute. So look at this image. In the palmar side, this is the middle finger. Middle finger is like a legs, and this is the first joint. In the middle finger, we are having three meridian, 1, 2, and 3. The inner meridian is spleen. Okay. So the inner meridian is liver, the middle meridian is spleen, and the outer meridian is kidney. Right now, our focus is kidney. So we are discussing for the kidney. Right now, our focus is kidney. Because we are having kidney 3, kidney 4, kidney 5, and kidney 6, 4 points. So we can see in this image, on the joint, we are having kidney 3. So this is the kidney 3. Just on the joints. Then if we go little up, kidney 4, then kidney 5, and inner side, that is kidney 6. So that is kidney 4, that is kidney 5, and inner side, that is kidney 6. The same imagination like a leg, if you know the meridian in the leg. So even in the finger, meridian points are moving in the same way. So we have to put the seeds here, we have to put the magnet here, and just applying the sedation mode, we can work very nicely. So with the help of these points, we can treat the pain because of the spur or bursitis. We can treat the pain happening because of the bursitis. Just add last, I want to discuss the Achilles tendonitis. अब सबसे आखिरी में बस मैं Achilles tendonitis का एक प्रोटोकॉल डिस्कस करने वाला हूं. So look at here. Locally what we do, if someone is suffering with the pain in the Achilles tendonitis, so this is the tendon. The name of this tendon is Achilles tendon, and the pain here, that is called Achilles tendonitis. So if this is tight, so the pain will be here while doing the stretching. So what we are doing, if someone is suffering with the Achilles tendonitis, those who are doing acupuncture, they are putting the needle here on the kidney 3, and putting the needle on the kidney 3 and taking out the needle from the other side, from the bladder 60. Only single needle inserting from the one side and taking out from the other side. If it is not possible, then put the two separate needle. One is here and one is here. Two separate needle. So we can put two separate needle. One is the kidney 3, one is on the urinary bladder 60. This is for Achilles tendonitis. So for the Achilles tendonitis, we are just applying 4 points. Kidney 3, urinary bladder 62, Li4 is a painkiller, and Li1. Sedate all the 4 points. This is very good for this tight tendon. It is very good protocol for the tight tendon. So if someone is having the problem of the Achilles tendonitis, just kidney 3, urinary bladder 62, LI1 and LI4. And we can also add DU20, LI4, gallbladder 34, plus kidney 3, urinary bladder 62, and LI1. So this is the point protocol for the Achilles tendinitis. If we want to see the location of LI1 point, because other point we have seen, the LI1 point is available the first point of the LI meridian. So you can see this image. In the index finger, this is the LI meridian, and the first point, that is LI1. Okay, 1 minute, 1 minute. It is not coming. So look at this image. This is the LI meridian, and the first point is LI1. This is the joint, and just before the joint, this is the LI4. So in the index finger, we are having 3 meridian. In the center, we are having triple warmer meridian, and the other side, we are having a small intestine meridian. Okay. So now this is the completion of heel protocol.